Hello and welcome to Healthy Nation. I'm Dr. Paul Knaufelmacher. The human heart is the most important muscle in your body, pumping blood to all your organs. But when you develop heart disease, it doesn't perform the way it should, and a number of problems can develop. There are different kinds of heart disease, but the most common is called coronary artery disease, or CAD. CAD affects about 13 million people in the U.S. alone. Stretched hand to hand, they'd reach halfway around the world. What makes CAD so threatening is that it tends to develop unnoticed over time. Each year, more than 500,000 Americans die from complications of CAD, making it the leading cause of death in both men and women. Coronary artery disease is caused by a condition called atherosclerosis, the gradual buildup of plaque in the blood vessels that feed your heart. Here's what happens inside your body during everyday activities like walking the dog. Arteries are blood vessels that carry oxygen-rich blood away from your heart to all the tissues in your body. Healthy arteries are clean, smooth, and slick and can expand easily to let more blood flow through when you need it. Like any muscle, your heart needs a steady supply of oxygen and nutrient-rich blood to function. Your coronary arteries encircle your heart like a crown and branch off into your heart muscle, supplying it with blood. Atherosclerosis is the slow, steady buildup of deposits called plaque in your arteries, which can start as early as childhood. Plaque is made up of fat, cholesterol, calcium, and other cellular matter circulating in your blood. Over time, this plaque will both narrow and harden the arteries, including the coronary arteries that feed your heart. When blood flow is restricted, angina or chest pain results. Even worse, the plaque can rupture into the blood vessel, forming clots that block the flow of blood in the heart's arteries and can cause a heart attack. Now that you know what causes CAD, let's talk about symptoms. You may want to pause and grab a pen and paper to write these down. It's possible to have CAD but not experience any symptoms at all. As it gets more severe, people typically develop symptoms. If your arteries can't supply enough blood to meet the oxygen demands of your heart, you may feel a pressure or tightness in your chest. This is usually brought on by physical activity or emotional stress, and usually ceases within a few minutes of stopping the stressful activity. Shortness of breath is another symptom of CAD, along with extreme fatigue after physical exertion. One serious consequence of coronary artery disease is a heart attack. This happens when an artery that feeds your heart becomes completely blocked. This is usually caused by a blood clot or other debris in an already narrowed coronary artery. Pain from a heart attack is often described as crushing or squeezing pressure in the chest and may feel similar to angina but lasts longer. These symptoms may vary for men and women. In fact, women often feel no chest pain but may have a combination of the other symptoms, such as shortness of breath, weakness, dizziness, or cold sweats. Women may experience warning signals a month or two before, like unusual fatigue, sleep disturbance, and shortness of breath. Unfortunately, some people are at greater risk than others. The risk increases with age and a family history of CAD. Race is a major risk factor as well. Hispanics, African Americans, Native Americans, and some Asian Americans are more at risk than other groups. You are also more likely to develop CAD if you have high cholesterol, high blood pressure, or diabetes. On top of all that, lifestyle factors like smoking, poor diet, inactivity, and weight gain increase your chances of developing CAD.